Okay, so everybody, welcome to Unboxed Healing episode 5. I'm Lindsay Acker. I am an LCSW. I am in New Jersey, licensed in New Jersey. My experience is over 12 years. I have worked in private practice, hospitals, community settings, digital mental tech health. And my last role was working with therapists who were integrating ketamine assisted therapy into their practice, which is where I met Meredith, and that's where our paths crossed. And we learned very early on that one of the missing pieces to this work was being able to talk about it and talk about all of the nuance and all of the really cool stuff that can happen too when we integrate these new modalities into practice. So that's what we're here to talk about today. And I'll let Meredith introduce herself and then we'll get started.
Hi, everybody. Thanks for joining us again today. Um, I am also in New Jersey, but I'm licensed in 5 states. So I have a small private practice here in Matawan, New Jersey, but I do mostly remote work. Probably 90% of the work I do is remote, and that includes CAP. So I've been offering CAP in my practice for the past few years. And before that, you know, did brain spotting training during the pandemic. And so it's been a really natural and awesome combination to add ketamine assisted therapy to brain spotting, and they complement each other really well. Now I'm an approved brain spotting consultant, so I take other brain spotters through the certification process, and especially folks who want to focus on integrating that with CAP. So I'm really excited. This is my jam. I'm excited to talk about this topic today.
Um, so yeah, we'll get started. And really, I think the most basic place to start is what is brain spotting? Because there's people here that might not know what it is, might want to learn about it. So maybe we can start with what it is, maybe a little history about it, and then we'll take it from there.
Yeah. So it's an interesting history. So brain spotting was adapted from EMDR, actually. The person who discovered brain spotting was an EMDR therapist, Dr. David Grant. And to make a really long story short, what he found was that he was working with a client and doing, the bilateral movement. A client was tracking his finger with her eyes. And what he noticed was that, like, midway through, she started to have a physiological response, like her eyes started wobbling. So he noticed like something was happening at a particular spot. And so he just invited her to pause there. And instead of continuing to go back and forth, just keep your gaze there. And so then what happened after that was this outpouring of material that they hadn't processed, in their years of working together. And so this was actually a athlete who was not able to perform. I think it was like the triple loop, something like that. And then, the story goes from that day, she was able to, perform the triple loop and like never had an issue again. So it was like a performance block tied to trauma. And this, just working from this one spot gave seemed to have given her the ability to access whatever it was that she needed to process, to be able to move forward from that. So, that was, I forget, is it 1994 or 2000? Yeah, I think 1994, 2004, something before. And then, Dr. David Graham just kind of dove into it from there, has worked with researchers and brain researchers just to see and try to figure out like what is this phenomenon. And there's nuance and layers, and there's like we're learning more about the brain every single day. So there's always new information coming out about like, how does this work? We don't really understand because, we have like quadrillion connections in the brain. So, um, the theory, as it stands now is really that our eyes are directly connected to our brain, right? So it's a natural phenomenon. So you might find as you're talking that your eyes go somewhere. I know mine do. And now I used to think like, oh, I got to come back to eye contact. That's what we're taught. But I now let my eyes go because now I know from what my understanding is that our eyes go where they need to go to access the part of the brain that's holding the information that's being processed. So as I'm talking about this thing, my eyes go here naturally. The part of my deep brain that needs to be accessed, that's holding this information, is being accessed. So that's kind of the theory behind it. And should I pause there or keep going? Because I could.
Yep.
Oh,
No, that's great. You can, I think maybe, yeah, you're getting into like the theory and the framework. So maybe we can kind of go into that. And, obviously this isn't a full training on brain spotting.
yeah,
You
I
have,
know I could like really
we'll
go there.
talk about that at the end, but, a lot of people watching or a lot of people here might be new to what that even looks like or means. So maybe, there might be people who are more informed on like EMDR. So like you had mentioned, um, the person who created, I guess, brain spotting or whatever you want to call it, discovered this treatment was an EMDR therapist, and that's kind of how he came across and started to research this modality. So maybe if you want to talk a little bit about what we do know from the research and what the eye movements kind of help the client and help you as the clinician kind of figure out, and then we can kind of go from there.
Yeah, so I do like to share a little bit about my own experience here because I'm really transparent about, my own mental health journey. I don't like get into the weeds, with clients or anything like that. But I'm a lifelong client. I've been in therapy since I'm 12 and traditional talk therapy so many years. And then going to grad school, getting a master's, learning CBT, DBT, like that stuff changed my life. But it just always felt to me like something was missing. And then I never really felt fully able or confident to work with trauma or like to hold space for clients with trauma. And so there was a point in my career where I was like, I'm just not going to work with folks with trauma. Meanwhile, I was like working in addictions treatment centers. I'm just going to work with anxiety. And okay, so then 2020 pandemic and oh, like it just dawned on me like everyone has trauma. Like everybody has something, right? And I really need to be able to hold space. I need to be able to work with clients when traumatic material comes up because sometimes it comes up and whether we we think it's going to or not, and our definition of trauma has changed over time too. So I found brain spotting in 2020 when I was looking for different trauma modalities. And what stood out to me about brain spotting over some other modalities was that it's client led. It's kind of like the anti-protocol. Like there's not like there are steps, but it's very intuitive. It allows you to be creative in your process. And so that resonated with me. And in my the phase one brain spotting training, the first training that I took, the one of the first things they ask you to do is to identify where in your body you're experiencing whatever the thing is that you're processing. And I was practicing with a peer and I was like, it dawned on me that I felt completely disconnected from my body. I'm like, I don't even know what I'm experiencing in my body. And luckily, like he he just had the intuition to say, well, let's just start there. Like let's process from there, from that disconnected feeling. And I brain spotted from that disconnected feeling. And it was a 45-minute brain spotting session where I didn't talk. That was another thing I really liked about brain spotting, is that you don't have to talk about the thing. And I was just having these physiological responses, like probably from like someone just watching this. It probably looked like I needed to go to the hospital, honestly. Like it was like twitching, seizing. I don't even know what was happening. Um, and honestly, from that day on, I have been able to connect with the physical sensation. So whatever it was that like I had a process there, got processed in that first brain spotting session. And that was it. I was sold. I was hooked. I was like, okay, this is the thing. Like, this is the thing. I'm going to dive deep into this. I want to understand how it works. And I want to be able to bring this to my clients, especially folks that don't want to talk about their trauma anymore. They've been talking about it for a decade. They don't feel like that helps. Maybe they're even re-traumatized from talking about it. So to have an option where they can just process completely from like a brain body perspective was really just wow, like revolutionary to me. So the reason that the theory behind this is that I'm going to just pull out my brain here. Is so when we're talking, um, talk therapy, CBT, anything like cognitive, behavioral, we're processing from these outer layers of the brain. These are the most evolved parts of the brain, right? So like the deeper in we go, the more primal and primitive the parts of the brain are, right? The brain stem, survival, fight, flight, freeze. So when we're talking about stuff, when we're rationalizing, we're analyzing, we're challenging thoughts, we're changing behaviors, like that is super helpful because we do need to be able to have some tools in, daily life. But the thing is, we don't get to access those deeper layers of the brain where it's theorized that trauma is stored, which makes a lot of sense to me because this is all like our sensory information, right? So our senses, right, the fight, flight, freeze response. There's also no language there in this part of the brain. So that's why a lot more research is coming out about somatic therapies, and the reason why when we're processing from the body, from the deep layers of the brain, it's like sometimes we don't even really understand what's resolving or what's happening, but we can feel that something's being resolved. And that can be really hard sometimes because we're very like we think this part of the brain thinks it's in charge, so it's like we want to understand why, how, we want to have the language and the words, but some of it is just so deep in there that it has to be processed in a sensory kind of way. So, right, going back to the eyes are directly connected to the brain. When we're tuning into what's going on in the body, right, we're accessing those deeper layers of the brain, the sensory information. Okay, where am I noticing this in my body? And then we're processing from there. We can add in a kind of sound called bilateral sound, which is similar to bilateral, but different, a little bit different. And so it's really sensory and we don't have to talk. And then at the end of a brain spotting session, you might talk, you'll probably talk a little bit about like your takeaways, what came up, because then we want to get people back up into this part of the brain so that they can integrate it. So that's like in a nutshell.
Yeah, it's so interesting. Obviously, I know a lot about ketamine assisted psychotherapy and other psychedelic therapies and how those therapies work, which is in a very similar, obviously, there's substances involved and medication involved, and that's affecting parts of the brain. But in the sense of that nonverbal, you know, deeper layers where things come up in sessions that don't make sense in the moment. lots of feelings in the body, lots of uncertainty of what was that, or, you know, was I crying? I wasn't feeling sad, but tears came out, right? I don't know if anybody here either has experienced CAP for themselves or has facilitated CAP sessions, but that often happens a lot. And so I can see how brain spotting and ketamine therapies and other somatic therapies really go really well together because, we keep hearing and, in the age of TikTok therapy and Instagram therapy and all of these different people talking about somatic work and somatic healing and breath work. And I know that a lot of people aren't necessarily clinically trained. They might be coaches or might be trained in certain breathing. The theory is the same, that sometimes there is not language for um, how our body processes trauma. And trauma is anything, right? Trauma is anything that has affected you as a human being to not be able to move past that thing, or is affecting your patterns of behaviors, or your way of moving through life, right? So I think that's important too. And a lot of times, these words, we, as therapists or as healers, we hear them a lot, but to the lay person, a lot of people say, these words are overused and not everybody has trauma. And I think it's important, and what the whole purpose of these webinars that me and Meredith do is, we don't need to be in a box. You can label whatever you want, or you don't have to label anything. And I think that's where brain spotting and ketamine therapy, breath work, meditation, whatever it is, works so well because it is all client led. Now, having a professional there to be there when those hard moments come up, right? Or when the insights come up, or, they come in the next week and they tell you all about these insights or feelings they had in the week prior. That's where we come in to be the professional to be able to help them integrate. But I think this is a really good segue into kind of what I was talking about, how you were explaining brain spotting and how I experience when I do my ketamine sessions, how I experience those sessions, and then what comes up for me. So for me too, to share some personal, disclosure, when I started ketamine therapy about 3 years ago, I, like Meredith, have been in therapy since I'm, for 24 years or something, like the last 24 years or something like that. And yes, learning those tools and learning how to name emotions and feelings, and understanding that your brain and your thoughts aren't always truth. All of that's really important. And having an understanding of who you are, and gaining insights and being able to work and change behaviors is important. But at a certain part, how much talk therapy can you really do? How much, life happens, and yes, new things come up. But if those old patterns and old feelings, um, I don't want to say resolved, but I am going to use the word resolved, because if they're not resolved in some way within your body, they continue to pop up when more life happens, right? So for me, with ketamine therapy, even 3 years later, every session gives me something different, but it also allows for that non-verbal part of my brain to access like what my body is going through. And that can sound confusing if you've never experienced it, but the best way I can explain it is, think about this happened to me recently. Think about a day where maybe you wake up and you're feeling maybe you're not somebody who experiences anxiety all the time, but you're feeling tightness in your chest. You're feeling uneasy. You're feeling like jittery, but you didn't have any coffee. Or your mind is going because you have 1,000 things on your plate. And, you know, what most people do is, I just got to push through it. I just got to go through it. I got to get this done. I got to do this. But what I have learned to do now, I would have never done this in the past, is I go outside and I live by the water, I sit on a bench, and I might feel all these things. It feels uncomfortable, it feels unnatural. I feel like I might have a panic attack or I'm breathing really heavy. But the longer that I sit outside and I just focus on the water, right? Or I focus on what's happening in front of me, slowly but surely within 15 or 20 minutes, my body naturally calms down because that's what happens. And so a lot of these therapies, that is what's happening, but we get faster results because we either have medicine or we have eye movement of what we still can't really explain, um, of being able to then calm ourselves down enough for our bodies to eventually bring up feelings and thoughts to the talking part. Does that make sense? And I think, yeah, and I think that's how now we can like bridge the brain spotting and CAP together because they both come from this place of unknowing and then somehow they rise up to, oh, I didn't even know that's what I was feeling or thinking about.
Exactly. Exactly. No, and what you're describing is like top-down approaches versus bottom-up. Like it's actually called, right, up bottom-up approaches. So ketamine assisted therapy, brain spotting, other somatic modalities, when we're accessing like the deeper layers of the brain first, and then it's working its way up, right? Working its way up to the cognitive, more cognitive cortical, neocortical layers of the brain. That's what we mean by bottom up therapy. You might have heard that term. And when you might hear the term top down therapy or CBT, DBT, we're starting here and then maybe, getting deeper in there. But that's exactly what you're talking about, right? And yes, so brain spotting and ketamine assisted therapy are both bottom up approaches. And so again, right, like also my career as a therapist and my path, the trainings that I've taken have very much paralleled my experience as a client. So, fast forward a couple of years, a big life event, and found was introduced to ketamine therapy through like a local clinic. And so I didn't know much about this at the time. It was newer, like it was just like the first clinic popping up in the area. And I was like, oh, this is really interesting. I'm going to go do this. It was, IV ketamine. And there was no therapy. It actually wasn't ketamine assisted therapy. It was just a ketamine infusion, really. And then it's like, okay, we're going to pump you with ketamine and send you on your way. And the protocol is twice a week for 3 weeks, very intensive. And luckily, like I had already done all this work and I had a therapist. But it was a lot. Like it was very intense and probably, yeah, traumatizing, because I felt very alone in the experience and stuff was coming up and I was very scared and I didn't feel like I was supported through that process. So it really helped me like get through the thing I was going through, but I came out of it like there's like got to be a better way to do this. So that's actually what led me to look for training in ketamine assisted therapy, psychedelic assisted therapy. And so I did a year-long training in psychedelic assisted therapy. And here in New Jersey, ketamine is the legal psychedelic now. So I really focused on ketamine work. And so first my approach was to, contact every ketamine clinic and tell them how unethical they were and how could you do like, you need to have the clients need to have therapists and like no, they people don't really want to be told about themselves. So I think my approach was a little aggressive in the beginning and maybe that wasn't the best way to go about it, but I'm like really passionate about um the assisted therapy part because and now thankfully more research is coming out and more ketamine providers are getting on board with like, yeah, like this is a lot because if someone's never gone to therapy and then all of a sudden their like childhood trauma that they've been repressing for 30 years comes up, like that's not safe, right? So I think that it's definitely becoming more common that therapy is paired with ketamine, thankfully. And so brain spotting just naturally, for me, paired perfectly with ketamine therapy because um but in the beginning, the most of the work I was doing was, in high doses of ketamine, the psychedelic dose or the dissociative dose. That's my clients were experiencing that. And so, during the actual medicine session, we're really just holding space when it's these higher doses because there's not really the ability for dialogue. So, right, like we're holding space for them while they're laying back, they're having their inward journey, listening to music. So where brain spotting fits in these higher dose sessions is in preparation and integration, right, which is the therapy that happens before the medicine session, and then the therapy that happens in the day or two after the medicine session to process. So it's a great way to be able to process, let's say, some challenging material that comes up, right? For the reasons that I already explained, why brain spotting is such a great modality for trauma processing. It's also great, right, if the client doesn't even remember what came up in their ketamine session, or like it was like shapes and colors and like, I don't know, it doesn't they don't have to have the words with brain spotting. So that's really pairs well with those high dose ketamine sessions for integration, because just go back to like what do you notice in your body when you think about what you experienced the other day, or if you think about what came up for you, just notice what's going on in your body, and we find an eye position that corresponds to that feeling in the body, and then work with that. Um, and so, in preparation work, sometimes there's material that the client will feel like needs to be processed before they're ready, before they're ready for adding medicine to their work. So sometimes just adding ketamine in too soon, that can also be harmful. So there's a lot of, like we keep it very client led always. Like it's always at the client's pace. So we may plan to do, ketamine treatment together, but if there's some stuff that they need to process through first, it might be a month or a few months of preparation sessions before we even ever start with medicine work. Um, so that's at like the higher doses.
Yeah, and I think something for us to clarify, because I see a question here, is in those higher doses, the brain spotting isn't happening during those high dose sessions. So during the high dose ketamine sessions, they're having their normal ketamine session, and then it's either before or during prep, and or after during integration, where you kind of integrate the brain spotting into the subsequent sessions. So yeah, just to kind of make that a little more clear. And then Meredith will talk about during psycholytic dosing, which doesn't get you to that dissociative place. And because if you've ever experienced ketamine, or you've had a client, or you've heard about it, one of the things that ketamine does is it affects your spatial perception and spatial awareness. So if you that's why often people wear like eye masks, because if you take the eye mask off, you're all of a sudden like, whoa, my TV looks like there's three of them. That's something or if you're looking at a phone when you're on ketamine, you're like, oh, I have three screens like right in front of me, and so it would kind of be impossible on a high dose like that to do any sort of eye movement or whatnot. Also, you'd feel very like I would assume you'd feel car sick or like seasick or something like that.
Yeah,
Um,
yeah.
yeah, but that's a great segue into how do you integrate brain spotting with lower psycholytic dosing?
Yeah. So this is what I've been incorporating more now. Um, Lower dose or psycholytic ketamine therapy, it's it's usually more accessible for a number of reasons, right? It's less time intensive, and which then, affects the cost of the treatment, which also affects, and then the lower dose, they're not so like out of commission for maybe days, right? At high doses, there can be some space needed around the time that it takes to feel, back to really like ability to show up, whether it's like driving or um even working, right? Like some people, I know some therapists that recommend, if clients do the higher dose ketamine treatment, that like if you can take some time off, because it can be, you can feel pretty disoriented for a couple of days afterwards. So so there's different dosing protocols depending on the prescriber you work with, and I've been kind of playing around with my own ketamine work, and then also seeing how this translates with clients at different, because a psycholytic lower dose, like that can mean different things for different people, even the higher dose, right? It's so see, sorry, I see your dog coming through in the virtual screen. Okay, sorry. Anyway,
Oh my gosh. Okay, that's
sorry, this
ridiculous.
is like, okay, let's go back. Here I am. So the dosing's very variable. Luckily, as the therapist, I stay in my scope of practice by staying in communication with the prescriber and letting the prescriber do the dosing, right? So different prescribers will have different protocols with how to help clients figure out their dose. But so anyway, that was a tangent. But low dose, meaning the dose is low enough that the client is able to engage in dialogue throughout the session. So just depending on the client and the prescriber and the route of administration, usually in psycholytic work, we're talking about sublingual ketamine, so troches or rapidly dissolving tablets. And it could be as low as 15 milligrams. For some people, that low dose is 100 milligrams. It's really variable. And so this is why it's important to have some kind of relationship with the prescriber that you're working with, so that you can really collaborate on the treatment plan. So in that lower dose, where it's low enough for the client to be able to engage in dialogue, you can do brain spotting as you would in a brain spotting session without medicine, but probably it's going to go deeper, whatever that means. So that might mean that they talk less, but access those like deeper layers of the brain and access different material. So you might see a more somatic process happening. Or it might mean that the client talks more, and what they're talking about things that maybe they wouldn't have talked about otherwise. And this is why, it's really important to do like further training if you're going to use this stuff, because it's really important to learn how to keep a client within like their, window of tolerance. I don't love that term, but that's like, I guess the best term to use is so at these like medium low doses. So some clients will come in for a psycholytic session wanting to do psycholytic brain spotting. But when they self-administer the medicine, they're really not ready. They might want a little inward time. So that can look like, they have a little bit of journeying time. And then we end the session with some brain spotting. So it can look a few different ways depending on the dose and the client and the day. So for me, something that really intersects, and I did a training on this, and Lindsay knows, like brain spotting concepts and how well that complements CAP. Because there's a few like terms I'll throw out here. One is following the tail of the comet. The comet is the client, right? So as a brain spotting therapist, we follow the client's lead. And so in a ketamine session, or even like a brain spotting with ketamine session, we may go in with the intention that that's what we're going to do today, but if the client gets there and that's not what they want to do, then we don't do it, or like it's always the client takes the lead. So there really is that, like, I come into the session, I really have to let go of any kind of agenda because I may come in like ready with my bilateral music and my pointer and ready to, go, but it's always open to what presents in that session and being able to shift it in the moment. So there has to be a lot of flexibility. Also, there's a concept in brain spotting called dual attunement. And that's where, we as the therapist are attuned with our client, which, most of us probably have that ability, right? That's like kind of it is a big part of what we do is we are attuned to our client, and then they feel that, right? Like they feel our presence there. But there's also this piece about being attuned within ourself and paying attention to what's going on in me, which leads into another concept called wait, why am I talking? So this applies in CAP also because I might want to really know what's going on, right? Like I want to know what the client is experiencing, but that might totally throw off their process if I start asking questions or offering prompts when they are in their process. If they're deep in their subcortical brain and I ask them a question, it'll take them right out, right into this where we want them to stay in that deeper layer of the brain. So it's always like coming back to myself. It's so much self-work in this of like, wait, why am I talking? Like, do I have an agenda? Am I trying not like, just naturally we want our clients to feel better, right? Like we want to feel like we did a good job, right? Like, and it's like taking that step back and like, wait, is this really to the client's benefit for me to ask this question? Is so the concepts that I learned in brain spotting training have really helped me in my CAP practice because of those things I just said, like that it just weaves together really well. I think I went on another tangent, but
Yeah. Um, we have a comment here, and this is really, I think, common and normal that when you are doing training, someone here mentioned they did training level 1 for brain spotting, and it was really hard to stay quiet as a therapist. And we hear that a lot when I was doing trainings for therapists integrating CAP into their practice. It's one of the things that a lot of therapists are like really worried about. And it makes sense, right? Because we all became therapists, not because we stay quiet. We all tend to be yappers, listeners, right? Healers, listeners, yes. But a lot of times, and this kind of brings back to the beginning where Meredith was talking about, when you're in school and you're trained and you're learning about these frameworks, of more of the cognitive frameworks, right? Of talk therapy, and um, DBT, which is, emotional regulation and tolerance and all of these things. And that is all about talking, right? And then now you're learning new theories and new frameworks that is not about talking. It's about being. And that can be really hard and confusing as a therapist. And one of the things I think that is so important, and me and Meredith have talked about this a lot, is when you're going through these trainings, when you're starting to integrate these modalities into your practice, is for you to actually experience those modalities as yourself as a client, so that you can kind of understand what it's like and what it feels like, so that you as a therapist can then feel more comfortable when that silence happens, knowing that these internal processes are happening with your client. So when there isn't talking and your client is silent, that's actually a really good sign. Right? Because that means that, and it doesn't mean that your clients who talk and it's not a good sign, but it means that they are in that journey or in that space or processing, and you're I think maybe the shift in mindset can be you are just there to make sure they feel safe. And Meredith said it best is the attunement and being able to feel your therapist in the room with you. So um, for, again, self-disclosure, I've been doing IV ketamine assisted therapy for almost 3 years. I do maintenance sessions, and then I do at home for in between. And just this past Monday, I had another maintenance session. And again, I can't even tell you how many IV sessions I've had. It's been a lot. And every time I go, it's a different experience. My therapist is always there with me. And there are times where I'm like, do I need my therapist here with me? I've done it so many times. I think I'll be okay. And every time afterward, I'm like, thank God she was here with me because sometimes the journeys are beautiful and fabulous. And I do just see shapes and colors and I don't really understand what's going on. And then other times they're really hard, but the presence that you feel, and this sounds woo woo, but it's not, it's real. Like the energy and the presence that you feel of your therapist or the person who's supporting you during those sessions is part of the healing, right? Because imagine if there was a part in ketamine therapy where you didn't trust your or brain spotting where you didn't trust your therapist or you didn't feel comfortable being silent with your therapist or your therapist was interrupting the process that you were going through, it wouldn't be pleasant, right? It might kind of take that person out. And so I think practicing and continuing to know that you as the therapist don't have to fix it today because the brain is doing the fixing. The brain is doing the things that words can't always do. And then in integration or after the session, that's where you get to kind of do your thing again as a therapist, which is talk. I don't know if I explained that well, but I know Meredith, for you, that was something that you had to learn and continue to learn. If you want to talk about like your learning process with, oh my gosh, staying quiet.
Oh my gosh. It's been like unlearning. Like that's how I think of it more than there's been a lot of learning, but it's been so much unlearning because I I, I think in so much of the therapy I've done as a client, right? What I was taught in school, the trainings I did early on, it was all about that. Like, how do I challenge this thought or um talk my way out of whatever? And so learning that like actually that can that can cause more harm sometimes. Um and also that just disrupts the process of like going deeper, like literally into the brain. There was a lot of unlearning and yes, it was so hard and still hard, right? To sometimes, when I have like the wise words or like I feel like I know, I have to like remind myself I'm not the expert. I'm not the expert. I'm not the expert of this client's life, of their brain. Like it's like this ongoing trust that the brain is amazing. Like our brains are, I could really just like nerd out on the brain, but it it knows what to do if it's given the space and the opportunity to. Um, I'm in a brain spotting group that meets every other week, and it's a group of brain spotting therapists. But we were in a group this week that the facilitator left. It's like it was one person brain spotting, but everybody was brain spotting, and the facilitator left like 30 minutes of silence, and the the person that was like the doing the brain spotting was quiet, like their process was completely inward, and we were all just quiet together for 30 minutes, and it was the most uncomfortable and like magical thing that happened. It was a group that like did not feel so cohesive at the beginning, and just being together in silence for 30 minutes, like the group was so connected at the end. So there's so much happening in our own system, and then like between systems. I got chills. Like it really, it's really powerful. So yeah, a lot of unlearning and learning. And yeah, I'll stop there.
Yeah. Um, we have about 5 to 10 minutes left. So usually at this point, we'll open it up. And if anybody has any questions, you can take yourself off mute. You can write questions in the chat box. And if nobody has questions, then me and Meredith will just keep talking. Joanne.
Hi. Um, I love this. I love that you're doing this. So thank you very much. It's very insightful because I'm also certified in brain spotting and psychedelic medicine. And so I've always heard people talk about combining them, and I never could understand, thinking to myself, well, during the session, when they're on a high dose, there's no way we're not talking. Um, so doing it, of course, makes sense. Prep and integration, that makes complete sense. But I'm more curious about the psycholytic. And then also for examples of on the psycholytic, like, are we talking 100 milligrams? Are we talking 10 milligrams? Like, where are you at when you're talking about the psycholytic with people? And I know it varies for every person, but I'm just curious if what your thoughts are on the psycholytic.
It does. It varies so much. So right, like I have, and it's sometimes it's trial and error with clients. So they might come in with a dose that was prescribed, and then I like to use an assessment tool to kind of determine at the end, maybe talking to your prescriber about a lower dose or a higher dose, just depending on their experience. But and some clients do like to have that like 10-minute, 15-minute inward time, even in a psycholytic session, and then do some brain spotting. But so for me personally, it's 50 milligrams. Like that's my psycholytic dose where I can do the work right away. And um, at this point, it's like when I'm in a therapy session, I want to make the most out of my time. Sort of, this is like my own thing, but I can like do an inward process on my own. But when I have my therapist there, I like to do some brain spotting or parts work. And so, yeah, that's for me. But for some people, it is 10, 15. So
Mhm.
it really is some like discovery period. There is a company that does a discovery period until the client gets the dose right for psycholytic work, and then you kind of know moving forward. So it is kind of figuring that out, and then working with that each individual client.
Yeah. And I think too, um, I think that's the importance of having a prescriber that you can really collaborate with and a prescriber that really understands what they're doing and what they're talking about. Because it also can change session to session. So for Meredith, she says for herself, 50 is kind of her psycholytic. For me, it's a lot higher. I don't feel for sublingual, I don't feel anything until I get to about 200 or 300. So, you know, and then there's people who feel everything at 100, right? Or 50. So I think it's really we used to say this a lot in our the trainings that me and Merit did with CAP. It's first really getting familiar with the medicine and having the client and you and the prescriber, how do they respond to the medicine? What is their threshold? And I think that's likely, and Meredith, correct me if I'm wrong, but I think that's likely, if you're going to, you might have already been doing brain spotting for a while, or maybe you haven't, but if you're going to start integrating CAP with a client, I think it's really important to go low and slow and to then figure out where that psychedelic doses. And there might be times, I know for me personally, there are some times when I'm doing at home where I'm like, you know what, like I don't want to fully dissociate. I want to be able to like do things later on in the day. I want to be able to talk during the session because I do have things to talk about, but I know that I need to get the medicine in. So that plays around with it too. And kind of what Meredith was saying is it's client led. So they might come in that day and be like, I just want to not talk today and zone out. And that's when you're like, okay, well, there's not gonna be brain spotting with the cap today. Or they come in and they're like, I really want to get the benefits of the medicine, but I have a lot to talk about. So I think that's important too.
Yeah, thank you.
I have
Yeah.
a question.
Go ahead.
When you say disassociate, is your brain is still working, processing, being present, or no?
I think,
Obviously, this will be in higher doses.
yeah, I think dissociating, it can be a confusing word, and I think it's different for every person.
Mhm.
Um, For me, what that means during ketamine is that my thoughts are able to flow. That's how I know I'm in a dissociative state when I'm no longer thinking. I'm no longer thinking. I'm in the moment and I'm experiencing being in that moment. And that's why with music, for instance,
Right.
I'm might be seeing shapes or sounds that are going with the music, or I might be feeling certain sensations in my body. Maybe I have a thought, but that thought, as fast as it's there, it goes. And that's how I know personally for me that I'm in a dissociative state. Because when I'm not, my brain is my therapist calls it toilet bowling.
Uh-huh.
Like this, right? And so I know I'm in a dissociative state when I'm able to um, just be. For some people, it feels different. Other people have explained it of feeling like they're outside of their body, kind of looking down. Um, Meredith, I don't know if you have a different explanation.
Has
And
someone else like freaked out when you guys were in session? When some clients have always like freaked out because I never done ketamine. I got certified, but I'm kind of like, oh my God, I'm kind of freaking out. I don't want any client to freak out in my office. Because self-disclosure, I done ketamine many years ago, but in a recreational way.
ah,
I kind
Very
of know
different.
what it is, but it's like, I want, it was in a recreational way, back way then. But I'm like, yeah, but they're processing trauma, so I don't want them to freak out. And I'm still in that, you know, not fearful, but kind of like hesitant.
yeah. No, that makes sense. No, and that's a lot of people are coming in with maybe recreational experience or like what they've heard about
Mhm.
ketamine and no, yeah, it can be scary. And so where we talk a lot about, and I just shared actually in the chat here an upcoming training that Emily and I are doing. Emily wasn't able to make it here today, but we're going to talk more about this, that like the set and setting is so important. Number one, like that's, probably when we were doing recreational ketamine, like we weren't really thinking about that part and like having the therapist there to process. And also like Lindsay was saying, starting low and slow. That's why I've been doing and starting a lot more with this psycholytic low dose work, because then it's like, it's a very subtle start and introduction to cap, where it can be really jarring for someone to go in at the high dose, and plenty of people do it. It's like holding the space around it. It's that's why it's really important to like dive into training and having like consultation around it, because it's totally different. It's like it's literally right, like an altered state. That literally, yeah. So that would be my recommendation if you were going to try yourself, if that's medically appropriate and just appropriate for you, is starting low and slow. And that's been what I've been encouraging more, to introduce clients to CAP who are worried about like really going too deep too fast. Because then once you are familiar with how the low dose feels, then it's like, okay, maybe that's all I really need, or maybe something more intensive could be helpful.
I see our time, and before we go, I want to thank everybody who came live, but also Meredith put in the chat. But for anybody watching, if you want to learn more and get trained in brain spotting or brain spotting and low dose ketamine, Meredith has some trainings that she does. So I don't know if you want to talk about that real quick, and then in the follow-up, we'll send that information.
Yes, definitely. So all the trainings that I offer, you can find on my website. It's integrativejourney.com. And this particular training that I shared in the chat, it's called Where You Look, How You Heal. It's brain spotting in psycholytic low dose cap. And I added a coupon code here for listeners of the show. So if you use code UNBOXED, like the name of the show, Unboxed, you can get $20 off that upcoming brain spotting and psycholytic cap training. So if you have any questions, you can contact me through my website, and I'm always happy to talk more about brain spotting, cap, all the things. It is a live training, yes.
Perfect. Thank you, everybody. Thanks for coming. Thanks for the questions. And we'll see you soon.
See you next time.